and supported today by Steve and Jim Smith, who are also on the call. We obviously there's a lot of us, so please do introduce yourselves in the chat, say hello, make some connections, and we will hopefully have some great conversations and questions at the end of the presentation. So what we ordinarily do at this session is a very brief update from the NHS England perspective of what's been happening out there, what things there are coming up on the horizon. So I will quickly whiz through that, and then I will hand you over to our speakers. So our team update from March, these are the kind of broad things that we can share at the moment. You will have heard us speak here before about the GP quality statements refresh. So this was formerly the GP quality markers on unpaid carers. So a lot of stakeholder engagement activities took place in February, and Jim has been working really, really hard and doing the final write-up of the document following the suggestions and changes through the engagement and working with stakeholders and different departments and bodies to make sure that we get this in the best place we can. So watch this space for publication. We're hoping, Jim, and please shoot me down if I get this wrong, but we're hoping to publish around Carers Week.
That's right, Rach. That's right.
Yeah. I mean, don't hold us to that, because the NHS England processes for getting things through publications are rightly so quite robust, but it might mean that there's a bit of slippage on that, but that's our aim at the moment. Another piece of engagement that we did earlier in the year is engagement sessions with young carers, and that culminated in a cross-government summit on the 19th of January. That was really well attended, really successful. We're in the process of writing up the outputs of that at the moment. And a young carer video resource to support the young carers guidance was officially launched on Young Carers Action Day. So if you haven't seen that, we can perhaps put the link to that in the chat. And this is featuring 2 young carers that we've worked with really closely over the past year to 18 months, who supported with the cross-government work and data summit and lots of engagement activities. And they talk really candidly about the impact of unpaid caring. We are still doing some work with the Digital Home and Communities team, and we're exploring opportunities to enhance unpaid carers identification. We meet with the NHS app team regularly. We're looking at how we, what opportunities exist within those pieces of work to enhance support, identification support of unpaid carers. And this is linked to the 10-year health plan. So if you're familiar with the commitments in the 10-year health plan to unpaid carers, we are doing a specific piece of work around that on digital, and we'll hope to be able to update you as these webinars take place. So keep you posted on that. We have been doing some scoping with stakeholders around options for unpaid carer support, and that's directly linked to the digital work. So we may come out to you at some point to ask you about your experiences and what offers of support for unpaid carers are out there. So we can look at where there may be any gaps and make any recommendations. And the conference, we're still hoping to go ahead with the conference in September. So work is underway to source a venue that's appropriate, accessible and cost effective. So we'll be getting together with stakeholders to agree the conference themes and aims, target audience and the scope of the working group, etc. So there is some of the things that our team are working on that might be of interest to you. And obviously, you know how to get in touch with us if there's anything in particular that you wanted to check in with us or talk to us about or showcase yourselves. We've got lots of opportunities to showcase good practice around the country, and we love it when people come and talk to us about what they're doing. So I'm going to take that as a reasonably decent segue into our presentation. So next slide, please, Steve. I'll allow you guys to introduce yourself. Suzanne and Tom from Mobilise. Is that the next slide?
Thank you so much, Rachel.
And thank you for coming. Sorry, my IT is a bit glitchy, so I do apologise if I'm not quite with it. But welcome to Suzanne and Tom. Thank you so much for joining us today. And I think you're going to talk to us about care identification and a case study that you've done for dynamic care assessments. Is that right? Yeah. Just before you start, Steve, how long have we got for Suzanne and Tom to talk to us?
They probably have about 20-25 minutes. Then we go into question and answers and feedback and comments after that.
Because I'm notoriously bad for
Don't worry,
keeping
we'll
people to time as
flag
chair,
you
because
up, Rach.
I get too engrossed in the presentation that I don't always remember the time. So I'll try and keep to time, and then we'll do some questions and discussion. Great stuff. So over to you guys. Thank you again.
Fantastic. Thank you very much. Hello, everybody. I hope connection's working okay. I'm dialing in from Hartlepool today. I'm normally down in Yateley in Hampshire. I'm Suzanne. I'm co-founder and Chief Carer Officer at Mobilise. And we'll tell you a little bit about our organisation. But first, maybe my colleagues want to introduce themselves. Tom, you're with us too.
Thanks, Suzanne. Hello, everybody. Great to see so many faces on the call today. Thank you for joining us. I'm Tom. I'm the delivery lead at Mobilise. So my job is really to help organisations embrace everything that Mobilise has to offer carers. And recently I was very closely involved in delivering some interesting GP focused work that we're excited to tell you more about today.
Fantastic, thank you. And my colleague Neil is also there in the chat, so he'll be there to sort of answer questions as we go, if there's sort of quick things we can respond to as well, but hopefully time to have more conversation and Q&A as well towards the end. So I'm Suzanne. My role with Mobilise began around 6 years ago. I'm also caring for my husband Matt, who has young onset Parkinson's, and like many others, those extra caring roles keep appearing. My mother-in-law has Parkinson's and various other health complications, so we're kind of we're in the thick of it, and we're getting back into it, I think, again as a family. So today we'll do a very brief introduction to Mobilise for people that may be new to us or haven't experienced us, and Tom will talk about the GP collaboration and the SMS campaign that we did, and we'll kind of bring that to life really with the really interesting bit, which is what impact did that have on carers? What was the carer experience of that? And then I'll talk about our dynamic carers assessment work that we've been doing as well, and kind of how that began and how carers were involved in developing that particular tool. Fabulous. So Mobilise, we're an online organisation. We're working across the UK, and we're working in partnership with a number of local authorities. Tom, do you want to flick onto that, or whoever's driving, have on the next slide?
Yeah, Rachel, thank you very much.
Oh, is it Rachel driving? Sorry. So the key things here, the key principles about how Mobilise work. So a lot of our focus is on upstream prevention, so identifying carers earlier, before they know that that's might be a word that they've used to describe themselves, and to sort of where there's more prevention is possible, so that prevent, reduce and delay is a really big part of what we do. We use technology because it's a way of really doing that in a scalable way, but also more importantly, a way of bringing people together into community. And that's where the word mobilise comes from, that we're mobilising the knowledge, wisdom and expertise of unpaid carers, so that together we can care and thrive. We can learn from each other, we can share resources, we can share stories and journeys, we can support one another. But that's really where Mobilise has built up that expertise from listening to carers, from spending that time in the carers community. So we're very much, Mobilise is very much a we kind of place, as well as being an organisation. So the next slide, please. So carers often find out about us through digital marketing campaigns, is traditionally how we've been working. So we'll pop up in people's Facebook feeds, on Google Ads and other places, and on Google search terms, and that range of things that we're using is expanding as technology changes and as user habits change as well. Most carers will experience Mobilise on their mobile phone rather than on a desktop, because that's just the general reality. It's very easy to forget that when we're probably maybe sat at a desk today or sat at a screen. Many carers, it will be handheld. So ads will pop up. People can download and join the community via the Mobilise app. There's also the website, which has a whole host of tools, and all of that kind of connects and brings together through regular emails, WhatsApp messages, and various different routes for carers to be able to connect with a whole wealth of content, to connect with each other, and to use some of those digital tools. And we'll explain a little bit more in relation to the GP project, kind of what some of those digital tools are as well. But that's a quick background. There's loads of stuff, kind of short form videos, stuff on YouTube, things on social media, etc. And our lovely little friend Moby as well, appearing in a cartoon strip, is all part of what goes on for Mobilise. But we've been looking more recently at different ways to identify carers and different routes to bring carers both into support, but then to continue and engage with that support, which is really key. So Tom, shall I hand over to you to tell us about the SMS project?
Thank you, Suzanne. And the next slide, please, Rachel, that would be great. Thank you very much. So yeah, thinking about specifically some of the identification work that Suzanne just spoke about, just wanted to share a little bit about some of the work we've been doing specifically within primary care, and again specifically within a GP practice in Milton Keynes, and in partnership with BLMK ICB, and Tom May, I hope is here, and we'll speak a little bit to that as well in a minute. But really the starting point to this work was that we know that a number of carers are already in GP systems, and often they can be invisible as carers, and often they show up within a GP setting with stress or burnout or longer term conditions, and no one's necessarily flagged the underlying cause or recognised perhaps they needed some support before that point. We know that practices often know that's a bit of a problem, but might not have a capacity to go looking or identifying carers. So we did a piece of work with BLMK and within Milton Keynes to make this as simple as possible. So developed an SMS campaign to about 18,500 patients, which was most of the patients that they had on their books there, with effectively a message, as you can see on screen there, effectively saying, if you're caring for somebody, free support in the area exists, click here and find out more. And that took them to a particular resource that we have, and we'll talk a little bit more later on about all the variety of support that carers can access through Mobilise. But crucially, from a GP point of view, there was no new technology. Obviously, the SMS functionality and technology there exists all the time. I'm sure you've received a text message from your GP at some time or another. There was no additional training that was required, nothing really additional extra asked of the practice. They used their existing system. Mobilise wrote the message and managed everything from a carer tracking point of view. And as I said, anybody who clicked and who that message resonated with them went straight to Mobilise. So not a GP appointment, not on a waiting list anywhere, but immediately getting support, which is obviously a good thing. If you could flick on, please, Rachel, I'll tell you a little bit about what happened. So we did that over the course of a single week. There were over 250 carers who self-identified, who saw that message, who that message resonated with, and they were able to come and sign up and access some support through Mobilise. 80% of which had never accessed any carer support before, so they were completely managing alone. So to be able to give them that nice, quickly and easily, and in a kind of relevant, accessible form was a really positive thing. We saw a really strong response from the sort of 60 to 75 age group, so arguably exactly the group who we most need to reach, and we know that cohort is at high risk of burnout and perhaps their own health declining if they go unsupported. And again, crucially, none of them necessarily needed a GP appointment to get that help. They went straight to support, and the practice in question were able to surface a hidden population without kind of additional consultations. So really, in short, a nice example of practices who may not have capacity to do any proactive searching or outreach of carers, but offering a very kind of low effort and low risk approach, help to surface those hidden carers and provide clear kind of engagement data, which we were able to do in return. And as we'll touch on a little bit later, and Tom, hopefully from the ICB, will be able to come and speak to this a bit more, fitting squarely with some of those NHS kind of prevention and early intervention and digital self-management priorities, which we know are kind of top of the agenda at the moment, and crucially with Mobilise kind of carrying that delivery workload rather than spooning more onto or shoveling more onto practices. So that was a nice thing that we could speak to. If we could flick on, please, Rachel. Suzanne and I were just going to talk about, so we've covered kind of the identification element of the Mobilise work. We'd talk a little bit more about the second kind of main component, which is around the ongoing digital support. Suzanne, do you want to chime in, or shall I?
Yeah, so the first thing that carers experience is the personalised guide to caring. And so at Mobilise, we try to limit how much data we collect from carers in order for them to receive support, making sure that the data collected, it makes a difference to the support they get. So in this example, people will have told us the relationship with the person they're caring for. So we get a sense of whether they're caring for a partner of their own age, a parent, or a child, or an adult child. So that we can tailor the support to that as well. We also ask them if they're new to caring, who have been caring for some time or have received support before, just so we can pitch it at the right level. That, you know, are we taking it right from the beginning, or are we just doing a quick check through of some things they may already have done? And the personalised guide is delivered very simply by email, so very low tech, by email over a series of emails, so it's not overwhelming, and taking people through those very basic steps that carers in our community said they wish they knew about at the beginning, and that's how we designed that sort of particular piece of content. So things like registering with your GP, so sending them straight back to their GP. Right now that you've identified as a carer, you can register with your GP, and reminding them about local carer support, carers assessments, and things like, you know, starting to think about looking after their own health, finances, and benefits, and other support that may be available as well as introducing them to the rest of the support that Mobilise has, the community, the opportunity to book calls, etc. So one of the things somebody might want to have a look at is to see whether they're eligible for carers allowance, and, you know, really very quickly understand whether it's worth taking the time to do an application with a few simple questions just to point them in that right direction for the next step. And if they're not eligible, but well, what next? What else might help? So they do that using the Carers Allowance Tool Checker is a quick guide. There's also an emergency plan template, again, just to get someone up and started with the concept of starting that emergency plan. It's something we revisit a lot at Mobilise in our cuppers and in our Mobilise live events, and regularly in content as well, because sometimes it takes more than one go to get that done. But our guide and our templates keep it sort of very simple, as a simple starting point, with that message of better done than perfect, really to encourage people to give it a go, because it can be quite tricky. Yes, and the next slide, please, Rachel.
So, has that come through? Sorry, there might be a slight delay on my side. So yeah, continuing kind of the ongoing support, digital support for carers, are three other kind of main elements to tell you about. So we have a weekly e-support newsletter, which is kind of locally dynamic content based on kind of current themes and any kind of community discussions that we're seeing. We see really kind of high level of engagement on that throughout the Mobilise community. There is a strong thread of kind of human-led support. So although we're a digital organisation and are all spread across the country, we have an amazing carer support team who offer one-to-one virtual calls that carers in our community can book, and they're flexible hours, so throughout the evenings and over the weekends as well. So kind of a great thing that we can offer is the one-to-one carer support calls. We have the Mobilise Hub, picture of which over on the right there, which is our kind of 24/7 peer-to-peer platform for carers. So we've got several thousand carers in there from up and down the UK. Lots of posts and discussions about specific issues, either condition specific around the person that they're caring for, or people that they're caring for, or maybe things around kind of financial questions like applying for PIP, or basically any question that a carer might have. There will be a discussion, and there will be a community of people there helping them out. That is moderated by the support team that I mentioned for safeguarding and for guidance and that kind of thing. And again, what we're the main thread and the idea, and particularly in this instance, is that we are getting to carers earlier, giving them a place to go, and by the time hopefully they've rather than kind of thinking about calling a surgery or making an appointment, they may have already found what they need just through timely and accessible information and guidance. And one final slide to put onto that is for the next one, please, Rachel. So our digital platform offers a range of courses. So these are fully kind of mobile friendly, bite-sized, flexible courses for carers. So things, as you can see, on things like well-being and self-care or emergency planning. Again, very well received. Carers can sign up if they think it's relevant for them. All of this is on offer to carers in our community. There's no means to say have to do all of it, or they're suddenly signed up for absolutely everything. It's about kind of bite-sized, accessible information that is carer-led and kind of taken into their needs taken into consideration. Really, the goal being support is accessible and manageable, integrated into the often chaotic daily life of a carer. So, and again, knowing that if people have got consistent and accessible support, built around that caring role, then it takes pressure off any other kind of services around them in a way that hopefully feels natural to the carer. Anything else to add on that, Suzanne, or we nod to the data?
No, I think that's it.
Next slide, please, Rachel. Just throw back to the pandemic here with the next slide. But so we've spoken a little bit about identification, a bit about ongoing support, and I guess the third kind of pillar to Mobilise's bow, or the string to the bow, I should say, is that we capture an awful lot of rich data on the carers that we support. So this is just an example that we can see on the screen in front of us, but we can see the location of carers that we're supporting, the demographics of them, and the types of content that they're engaging with. So all the things that we can and that we do offer carers in a digital way. We can see the extent to which they're being engaged with, who's looking at them, and in the example, and tying it back to the BLMK example, and using it in partnership with something like an SMS mechanism, it becomes quite powerful because we can see exactly where carers are accessing Mobilise from. We can have a look at a local map, and we can identify maybe harder to reach areas or communities and target them more directly. I think one of the things that we learned from our SMS campaign down in Milton Keynes was that it was a really effective way of targeting people and giving them that support. So we know that kind of we can do that in a really targeted way and use other data sets to be able to understand where some pockets might be being missed and where we can kind of reach carers where they are as a result. So as I said, really great opportunity to match our data with perhaps some local health data as well, to get hopefully a really joined up picture. As I said, to sort of demonstrate not just who we are reaching, but who we're not. And that shows where the real opportunity is, which is a really cool thing. We've got a couple of mini stories, Rachel, on the next slide. That'd be great just to fire onto that. So we've got Matt and Jenny here. So these are a couple of examples. These are people who are based in Milton Keynes who replied and engaged with our SMS campaign. So Matt is a long-term carer for his child. He came, as I said, to us through the SMS campaign, having never been connected to any sort of support before. Through Mobilise, he sorted some practical things like his blue badge eligibility, looked at some benefits guidance, and explored the range of kind of the Mobilise offer that Suzanne was describing there. So a kind of a collection of small things that made a big difference when, for someone like Matt, who'd previously been navigating things alone. And we also had Jenny, who was newer to caring, looking after her partner, still working full time, and a similar story in that she came through the SMS campaign without any prior support, and she's now regularly using the platform, things like the Carers Allowers checker. She's been linked into Citizens Advice, getting some weekly guidance, and it's just become part of how she manages her caring role, which is a great thing to see. So two slightly different situations there, but I guess illustrates a similar gap in that they were there unsupported, managing largely on their own, and a simple text message was enough to change that and to bring them into the Mobilise community, which is a really cool thing. the next slide, please, Rachel. I've slightly lost track of time personally, so do kind of give us a shout if things are going a bit sideways. But we'll hear from Tom at the ICB shortly. Hopefully he's here, and hopefully he's primed to say some nice things in a minute. But just wanted to touch on, from our point of view, why we wanted to partner with Tom and his team at the ICB and with the GP practice in Milton Keynes. Because there a number of things that are important for us to sort of to show. First one being there's potential for this to kind of reduce pressure on practices. As we said at the beginning there, carers can present as stressed or exhausted or unwell themselves, and by being able to support them earlier, we know has the potential to prevent additional appointments or prescriptions or crisis calls and things like that. And as we've seen, some of the Mobilise kind of self-management support and peer advice and signposting means that they often carers don't have to rely on their GP as their go-to, which is not always the case, but often is the case. Secondly, we know that it kind of aligns with NHS and ICB priorities. So, as we said, the 10-year plan around it being digital and community focused and grounded in prevention. We know that for kind of primary health professionals on the call, there is a bit of a need to demonstrate kind of efforts towards carer identification and support. And what's been great in this particular example is that Mobilise is a ready-to-use resource in the Milton Keynes area. So then being able to signpost carers without having to kind of build something else or do anything else in quite a kind of low effort way was a great thing. And I guess linked to that third point is that we know that there's something like this can support your responsibilities and compliance in this area. And as we said at the beginning, with unpaid carers often being hidden, then it gives them hopefully a simple mechanism to engage with and find support in a nice and easy way. And crucially, giving primary health organisations and GPs something tangible to point to. So a proactive, measurable approach to carer identification that you can evidence. So I think we do have Tom, the integrated neighbourhood manager at the BLMK ICB. We do have kind of a second, not quite half, but a section to the presentation to talk about another piece of work, as you'll have seen in the sort of sign up to the session here about our dynamic carers assessment. So I hope Rachel, we've still got kind of 10 minutes or so if we've got time to look at that. If not, then we can take the conversation wherever it goes. But perhaps if Tom is there, then we can.
I mean, if we can keep it to 10 past, that'd be great, because there's quite a lot of questions in the chat, which is really positive.
Okay, haven't seen
so it'd be good to have a bit of time for questions. But yeah,
by all means. Okay, well, yeah, Tom, if you are there, I can see many little faces, but not all of them. Give us a wave. If you're not, that could be interesting, or we'll think of something else to say. But if you are there,
I'm here in the introductions. He was.
Here he is. I heard there's a familiar tone I can hear. That's great. So yeah, Tom, I guess from your point of view, why was this something you wanted to do? Why is it important? Some summarising points would be great from where you're sitting.
Okay, I'll try and keep it brief. First of all, we are data driven, very much data driven. And so what we've done is we've worked with our business intelligence unit to actually get a quarterly report on care identification within practices. So I get a quarterly report which I share with the likes of Tom and Suzanne at Mobilise. I share with the local authority who commissions these individuals, and I also share it back with practices. So I've now got a quarterly report where I know the number of carers that have been identified in each practice, and we've broken it down into young carers, middle range carers, sorry, that's not the right phrase, and older carers. So if there's 100 in any practice, we know how it's segmented across those. And because our practices are varying in size, we've got some that are 40,000, some that are down at 5,000. We've got a carers identification rate per 1,000 population. What we see within our practices, and in Milton Keynes, we currently have 23 practices, that the carer identification rate varies massively between our practices. So at the top end, we've got 30 carers identified per 1,000 population. At the lower end, we've got 7. So it's like a 6-fold difference in a carer identification with our practices. Now, some of it is because some of them simply will have more carers due to their demographics, but quite often it is certain practices have good measures in place to identify carers. So the project that Tom and Suzanne were describing is we wanted to target a practice that already worked well with carers because we knew we would be pushing up an open door. So we picked Newport Pagnell Medical Centre, which was I think in the top 3 of our practices who identified care as well, and not only identified them but had good support measures. So they had support groups led by district nurses and others in place. So they were already very carer friendly. But what was really interesting, and I think Tom touched on it, when they did this text message, even though this practice was almost top of the pile at identifying carers, 80% of people that responded to the text message, and bearing in mind the text message was sent out to all adults, not just ones that we knew about that were carers, saying, do you have a caring responsibility? 80% of those were first-time identifiers. So it shows that we are tapping into a whole stream of carers that are not even known to the practice. So how can the practices support them, or how can the local authority or other agencies support them if we don't know about them? So for me, that was really a pivotal thing. Like Tom said, when we approach the practice, a couple of things that must be given. It must be it must not impinge on their day job because they are overwhelmed at the moment, and this didn't. Basically, we crafted the message, they sent it out, and the responses went straight back to Mobilise. So there was no admin, which is really important on behalf of the practices. Mobilise took that on and reached out and offered support to the carers. From an ICB point of view, why did I want to get involved? I know that carers are not identified as much as they should be anyway, whether it's local authority lists that are held in health. If there was a way that we could do this, this would sort of like tap into that unmet need. And going back to what Tom said in terms of why do we want to do it and how does it fit in with the NHS priorities, the 10-year plan, it's about shifting care from hospital to community. We need to go upstream, and having identifying carers earlier before they crash and burn, and the people they care for crash and burn, that's a good thing to do. Also, it looks more at prevention, and also there is a shift within the 10-year plan from analog methods to digital, and this again was a good example of how we could do that. So that's why I want to get involved. In terms of my practical involvement, I was just a broker. I just put Tom and his team in contact with the practice, made sure any issues or concerns were ironed out so they would engage, and then we just went for it. It wasn't overly complicated. I see something in the chat about coding. So as I say, 80% of people that came back were previously unknown to the practice. Now, we knew that might be an issue because, could Mobilise then share the data back with practices? There's lots of IG issues there. So the next stage of this, and we're already working up with our IG colleagues, is that when people register, we're thinking of having like a tick box at the bottom. You've registered, you've identified as a carer. Can we let your practice know, yes or no? So we can run 2 reports. I'll say Mobilise can run 2 reports, and then they can get consent to then share that data back to the practice, who can then code those individuals that were unbeknownst to them as carers on their record, and then they will know and be able to offer additional support within the practice. So the last bit that people were asking about coding, we haven't got there yet. We just did. Yeah, let's just see if it works. The next thing is, can we take it to the next level? Can we close the loop, get that data and feed it into the practices so they can offer practical support, whether it's offering double appointments or offering flu vaccinations or whatever additional support they need. But if they're not known to the practice, then they can't offer that. So we're just working with Tom and Suzanne just to close that loop. And we're going to go for pilot Mark 2, where we're going to get the IG sources out, get a data sharing agreement in place, and then we'll take it to the next level. I'm happy to share that.
Thank you
Tim.
very much, Tom. Really great to hear that. And yes, there's more work to do. It's a question of try something, see how it goes. Did people click? And then we'll start to work on what more we can do with that. So yes, lovely to be doing that ongoing work. And I guess then if we can share our next slides, the next thing that then comes up is, well, what we're going to do with all these people if we're going to be identifying lots more people, and if they're particularly when they're coming in through a digital route, what are the opportunities for making that support scalable, quicker, making sure we're not creating any backlogs and things like that. So we worked on our dynamic carers assessment. The project has been ongoing for about 2 years. The first year of it was just working with carers, testing things out, asking them about what they wanted, those co-production activities, listening on, on our Mobilise Moments surveys and polls, workshops, and well as just identifying trends in the conversations happening in the community as well, but also looking at the great data that's already out there. So we know that 76% of carers who get an assessment only receive signposting and information, that that extra sort of 24%, 25% going on to receive direct payments and further support. There's a big chunk of people where this process is mostly around signposting and information. And actually, let's make sure that can happen in a really timely and responsive way was our challenge. If we move on to the next slide, please. So what do carers tell us about the challenges with getting a carers assessment? Sometimes, my experience was I was told when things get worse, get back in touch. And I knew that when things got worse, I wouldn't have time to get back in touch. So sometimes that wait for the situation to get bad before they seek support. For working carers and that increasing number of working carers, accessing support during working hours, or in a way that works around their care needs as well, and their caring role as well can be a key thing. Sometimes having to wait a long time for that assessment, only to discover that it's signposting which they've either discovered by then or could have been told much earlier in the process. And changes into their situation that are quite live. So an assessment is done, a summary is shared and approved, and a support plan is produced and started to work through. And sometimes things that then change quite quickly. So the need for that ongoing support to be dynamically responsive to without stopping to reassess or causing a delay there. And for some people, it's different for everyone. The process can feel invasive or overwhelming. Having to talk to whether it's a social worker and the way that things are done locally. Now, these are often the challenges people have told us about, and we know that for a lot of carers assessment existing process works really well as well. So this, because we asked about the challenges, it's not all bad news, but that's what we want to focus on to see how we can what we can do about those challenges. So we click on to the next slide, please. So, and in the Mobilise dynamic carers assessment, it starts with the carer filling out an overview of our vision, really. So moving from what can feel like a very formal assessment that only happens to limited higher numbers of cases, so people that are eligible for have eligible needs, maybe getting an assessment, but what about those that we don't know yet if they've got eligible needs because they've not been assessed? People having to wait 3 months, and the assessment being a one-off event, maybe once a year, maybe less frequently, moving that to a more fully integrated support plan that carers can access, that the support plan is continuously updated, and that we make it fully accessible 24/7. So that was the vision, the challenge we want to overcome. We move on to the next slide. So carers start with a short form on a mobile phone to start their call, and they have that kind of baseline call. The call can happen instantly, or they can book it at a time that suits them, but calls are available 24/7. On the end of the phone is an AI bot called Claire, who will go through a number of questions and also respond to what the carer is saying, and we're sort of working on how that works and improving that iteratively as we go as well. And then they go through up to about 20-minute conversation on the phone, depending on how much the carer chats. They will then get a summary of their call. The carer then can either approve that summary or make edits to it. So that happens pretty much instantly. And then they will start to receive their support plan, and that gets automatically generated. and they'll have ongoing messages which kind of remind them of each step on their support plan, check in with them and direct them on to the next thing. So helping them to go through things at the right pace for them and to change their priorities if they need to. And sitting in the middle of all of this are human beings, you'll be glad to hear. So there's a portal, a sort of dashboard where social workers or social care practitioners can review those calls, review the support plans that are going out and make a decision to whether they think this carer needs some additional support and some ongoing in-person support, and will continue their carers assessment process that way. So that's particularly relevant if there's a complex situation, or if there's eligible needs are emerging, that, you know, and every local authority will have their criteria for what they will fund, etc. So then that local authority can apply that for themselves. So that's where the human in the loop is really important. The safeguarding element also very important, that sits right from the very beginning, that we kind of help carers to identify if this isn't the right tool for them, but also some automatic alerts in the system, both through the call and through the ongoing messaging, that identifies against a large number of risks. I forget the number, I think it's 23 risks have been identified, and risk situations that are identified. So not just picking up on keywords, it's quite a bit more sophisticated than that, but identifying those risks and flagging those up so a human being can step in and follow up as well. And I think, is there one final slide there? Or am I done? That's it. So we'll go to Q&A now, but myself and Neil are, if you want to have ongoing contact, do contact Neil if you're an organisation wanting to understand how organisations work with Mobilise. If you want to try out that dynamic carers assessment, I see there's carers asking about co-production and being involved in development, do get in touch. Or if you just think, I'd like to see if that would help me, do get in touch and we'll give you access. If you want to know more about the Mobilise community and just being a carer with Mobilise, do get in touch with me. I'm very happy to follow up. I think that's us. I'm really happy to take Q&A and hand back to Rachel and Steve.
Oh, thank you so much, Suzanne and Tom and Neil. Really fascinating presentation. So insightful. Lots of questions in the chat. I want to give people the opportunity to perhaps put their hand up first if there's anybody that wants to come in and make any comments or ask any questions. Linda. Hi, Linda.
Hello, Suzanne. Hello. Just a quick, this isn't a question. It's actually putting something that I put in the chat, because so many of the questions are technical, and I understand that, and I don't want to take time from others who want to know more. But from where I come from, I put that the carers who singled you out as the most supportive tops of anything that they did or did not receive really intrigued me, and I sort of said why. And they were saying things like, you were there for them on Christmas Day, you were there for them when the patient died, which so often you hear nothing from care organisations. In other words, it's the human side. So you've been fantastic at presenting loads of stats and competences and things about how you help, and but those are actually things too that others do as well. But I just wanted to say thank you from her, and thank you for being something that everybody talks about, which is, aren't we compassionate? Aren't we kind? Don't we care? But do we sometimes? How does it show? So thank you. Just wanted to say that, Steve.
Thank you, Linda. That's awesome to hear. And yeah, it's so key for us that we have that human contact. And that was the key thing about having the community, that as a team, we are every day chatting to carers and seeing what's going on in their lives and aware, and keeping those connections open, and keeping those chats going. So thank you, Linda. That's really heartening to hear.
Lovely, and really nice to get some positive feedback live during the presentation. So thank you. Any other questions that anyone would like to come in and talk to? You've obviously presented everything so well that if you've given everyone the information they need, and there's no further question. Let's just have a quick look in chat. There was, as Tom mentioned, Tom May, when you came in to talk about the work that you've done in Bedfordshire, Luton and Milton Keynes, there was quite a few questions in the chat about the ability to then, for those unpaid carers, to be coded within the GP records. I think you've answered that question. We're really interested to see how that work goes moving forward. Because if there was the ability for those unpaid carers to be coached in general practice as well, then it'd be really great to see how that's going.
Yeah, absolutely. Yeah, as Tom said, kind of a live project now, but really keen to come back and report back, or the next opportunity. That'd be cool.
Absolutely, always welcome back.
Mm.
Tom, did you want to come in?
Yeah, just on that front, on a very practical level, it's all round to IG, and I've spoken to my information governance lead, and as long as the provider has got their up-to-date DPI saying how we're going to now process this data and how we're going to feed it back and how it's secure, DPIA is a bit like health and safety. It's not a barrier. You just need to make sure that you jump through the hoops to make sure people's data is safe. So quite often people will use it as a red card, but it's not a red card. It's just like you just need to get your house in order. And as long as you've got that in, and before we go live on round 2, we will put that through our IG lead to make sure that she's happy with that. Then there's no barrier. It's just putting the safeguards in. So don't feel that it's you can't do it because it's too difficult to do type conversation. It's doable. You just need to do you just need to do your due diligence at the end of the day.
Yeah. Thanks, Tom. That's really helpful. I appreciate that. There's a question in the chat from Karina asking if there's any opportunities for carers to be part of co-production projects to support Mobilise.
Absolutely. First step would be to join the community, come and hang out with us. We often share opportunities to become, so some people are Mobilise champions, so they help to activate the community and sort of lead the way that the community goes, like what our topics are, what the content is, what our Mobilise lives are, and have a big role to play there. Some people get more involved behind the scenes and will come and comment on things that we're working on. So sometimes people can't necessarily attend a meeting, but will or a workshop, but will comment on a document that we'll share with them, or share information through a Mobilise moment. So everyone that's registered with Mobilise will be invited to share in there's 2 a month Mobilise moments, which are quick surveys on a particular topic and an opportunity to share a comment. So sometimes then there are carers there that we'll go back to find out more if they've got something different to share we've not heard before, or a theme that we want to explore more. We also, from like the dynamic carers assessment, we had carers that tested it out, but kind of went beyond that. They would test out, they would come back and feedback. We would then let them know what happened as a result of their feedback. And then there's a bit more, it kind of that ongoing responsiveness. But also just by being in the Mobilise ecosystem, where we can observe carer behaviour, where they're going, what's interesting, what they find difficult, what they find easy, where they get stuck if the technology is not working. That in itself constantly feeds back into that loop of, right, what can we do better? Because sometimes we want to just try something out. And I think it's a bit like the GPS SMS thing. You could look at all the things that it could do if it was really perfect and solve all of those data problems, but we'd get stuck in all of that. So before let's send the text message first, see if people respond to it. And if that works, right, okay, let's move to the next level and then start to scale it and start to make it work. So just by being involved in clicking on that text message, those carers were involved in co-production. They were telling us what worked and what didn't work. So we're keen on that. We do love a meeting, we love a workshop, and we make them fun and online and things, but we recognise not everyone can join in that way. And it's really important to get those different voices. So just by being part of Mobilise, you're part of what we share and develop. But I would love to develop a much kind of more specific hub of people that would really love to get into the technology and into the detail of it as well. And I think, we have, for example, we have every week, well, most weeks we have a different carer from the community will join the Mobilise team and just be there, sort of understanding the bigger picture of what's going on at Mobilise, and the rest of the team understanding what's happening for that carer, so that we can continue that work together, really. Our vision is that it just feels like we're one team and there's not the them and us. But we appreciate carers are busy too, and just grabbing their time is very precious.
Thanks, Suzanne. Are you going to be sharing the PowerPoints? I'll just ask you that quickly before we bring Melanie in.
Yes, very happy to. Neil, I think, has put his email address in if people want to have it directly sent out. But very happy to do that, no problem.
Marvellous.
Very happy to come and talk to other people too, anyone that missed it.
Okay. Thanks so much. Melanie, you got a question?
Yeah, it was just about the the carers assessment. So how does that work? The support plan that you put in place, is that support from yourselves, or does that link in to like local support depending on where someone is? Or
So in the very basic elements of it, so if a carer was testing it out for us, the support tends to be more what Mobilise offer. So our content, community conversations, book a one-to-one call, and do an emergency plan and things like that. So it pretty much Mobilise based. Where we work in partnership with the council, we build up a knowledge base. So there's a kind of a system developed now so that we can do that quite easily, because we know how quickly those directories go out of date. And if we were to Google and find something online and think that was right, so we really have to kind of hack into the intelligence of the local team, the practitioners, the front door team, the local carer support organisation, to bring in what's missing that we really want to make sure carers know about, because it can be so different in every local area. So that's a key part of the project working with local council, is to make that localised and to keep that up to date.
yes, okay, that's great, thank you.
Somebody's asked about, I don't know if you covered this in the presentation, so apologies, but somebody's asked about the response rate in terms of how many people respond to the text messages that were sent out via advert.
Oh, Tom, did you have the data? Was that, it might have been on a very early slide and we might have whizzed past it.
Yeah, it was one of the early slides. I think from the top of my head, there was around 18,500 messages, and we had between 250 and 300 people sign up, log into a Mobilise resource that we signpost them to. There's about 2% as a kind of conversion rate, which I know those numbers seem wildly different, but actually we benchmark that against what we'd expect to see in our kind of more traditional outreach that Suzanne was talking about on social media. So that's actually a good number of people in terms of like a rate compared to the number of people that it went to. Yeah, but obviously, as we've said, that was our first version of it, our first kind of pilot, if you like. That did go to everybody on the I think above the age of 18 on the practices books, and we know that for example, that younger age group didn't respond particularly highly compared to some older age brackets. So to repeat it again and to improve the process, we'd look to kind of refine that, either refine the message a little bit or kind of tidy up the audience size a bit. So as a kind of a blanket first stab, which was quite a deliberate move, just to see, will people engage, what will happen. We were kind of pleasantly surprised with that, but I think that could easily be improved with some messaging and some audience kind of hygiene. Tom, you might have a thought.
Yeah, one of the things that we were interested before we embarked on this was Mobilise their commission to engage with people that aren't engaged, essentially, with a digital product. And their traditional methods, as Tom mentioned, was through social media. And they had like a return on investment, like how many pounds would you have to spend to engage with a carer? And then we looked at this model, and this actually was you got a far bigger bang for your buck. Although you say like 18,500, you got 250 sign-ups or new identifications. When you look at that cost per head, it's like £2.30, £2.40, which is really good value for money. Even if you were a practice sending a letter out to a patient, that's probably going to cost you, if you sent it first class, I think it's gone up to £1.80 now, and it doesn't involve all, and that's just the cost of the stamp, not let alone printing the letter out or having admin time to mail merge and stuff like that. So in terms of bang for your buck, I think it's proved itself.
Yeah, and I think also that the fact that it's part of an ongoing campaign in other areas as well. So sometimes to build trust with that name and to know, oh yes, I will give them my details, I will share data with them. That's a key thing. So sometimes actually people hearing it from more than one place, it's a bit like the classic of, there might be a notice up about something, but have you read it? Have you done something about it? You probably need to see that notice a few times before you do something. So it's the same with sort of the digital thing. The more we can kind of remind people gently without getting on people's nerves, there's a cable balance there. There's also been a piece of work up in Wirral as well. Wyatt have done a similar piece of work and have seen similar results with that click through on the numbers that have come through. And So we would then measure, as well as that click through, and then what is the ongoing engagement? What did people go on to do? And obviously we want them to register and give us all the details and all the data that the council would love us to have. But sometimes that can be a barrier. So actually it's more important about them actually being able to access something, do something, than us, and then kind of build that relationship and then build up to sort of further more intense support, and particularly also that signposting onward to other services in the local area as well. That is really important, that they don't sort of stop at Mobilise, that should be, if it's the first door we've opened, then we need to keep, rather than just create a corridor for them to walk straight down, but keep opening the doors into the other rooms.
Thank you, Suzanne and Tom. Great questions, great engagement, great presentation. We are almost time. So just wanted to say thank you so much from us at NHS England for coming along and doing your presentation, and to everyone who's joined, asked questions and engaged. Really appreciate it. Another great session. And on a personal note, I'm quite excited by the fact that it's a Hartlepoolian. I'm in a room with people from Hartlepool, because if you're from Hartlepool, you know that doesn't always happen. So great to see people in the chat saying hi from Hartlepool. So lovely to see you all, and we will see you hopefully at the next bi-monthly, which is, Steve, is
the 20th of May.
20th of May. Oh, sorry, Jim, did you want to come in and say something?
Yes, please, Rach. So just to say that this time last year, we reviewed this group's terms of reference, the tour, which looks at purpose, roles, names of the group, membership, and frequency of meetings. We'll be sending that out again this week. So we agreed last year that we'd review it on an annual basis. So when you see that, if you've got any comments on that, please get back to Steve or have we send that out, and then we'll pick that up at the next meeting and sign that off for the following year.
Wonderful. Thanks so much, Jim. So yeah, do give us any feedback on that. We want to continuously improve on what are already great sessions. Okay, thank you again to everyone, and we will see you soon.
Thanks all.
Thank you very much. Goodbye.
Bye.
Bye.